I welcome you all in my channel Serious, and today I'm gonna talk about suicide prevention. Have you ever thought about this before? It is a topic that must be brought out of the darkness in order to save lives of the people. There are many organizations working on dispel myths and to bring hope and light to the subject so that those people who feel uncomfortable for taking help or to talk with someone about these feelings or thoughts. Unfortunately, suicide crosses all the age, racial, and socioeconomic groups in the US and around the world. In the US, suicide is the second leading cause of death among children and adolescent ages 10 to 24 and the third leading cause of death among 12-year-olds. Nearly one of the every 8 children between the age of 6 to 12 had suicidal thoughts. The suicidal rate is approximately 4 times higher among males than females, but females attempt suicide 3 times as often as males. When a suicide occurs, everyone is affected, including the people who are left behind. The primary symptom of suicide is talking about suicide or doing something to try to harm yourself. If your child expresses suicidal thoughts or exhibits self harming behaviors, seek professional help. There are many warning signs and risk factors for suicide. This do not mean that if your child or adolescent has some of these risk factors, then she or he will be automatically take his or her own life. Suicide risk factors takes account into many factors that need to be continuously monitored by a mental health professional. Remember that many factors combine to lead to a suicidal crisis or may include some of those that I am telling. Risk factors are mental illness, family history of suicide and or exposure to suicide, family history of mental illness, physical or sexual abuse, losses, aggressive behavior or impulsivity, lack of social support, poor coping skills, access to the ways of harming yourself like guns, knives, and etc. Difficulties in dealing with sexual orientation, physical illness, family disruptions, divorce, or the problems with the law, traumatic event. Warning signs are preoccupation with death, intense sadness or hopelessness, not caring about activities that used to matter in your life, social withdrawal from family, friends, supports, or social activities, substance abuses like drugs and alcohol, sleep disturbances, giving away possessions, risky behavior, lack of energy, inability to think clearly, concentration problems, declining school performances, increased absence from school, increased irritability, changes in the appetite. As I have told before, suicide is the most common leading of death among teenagers in the United States and in Delhi. In 2012, the most recent year from which data is available, over 40 lakh suicide deaths were reported in the United States. During that year, someone living in the US died by suicide every 12.9 minutes. It means almost in 13 minutes, every single person is dying. You can prevent suicide by being on the lookout for the warning signs as I have told above. You can also prevent suicide by asking about it. Study shows that people do not start thinking about suicide just because someone asks them about it. If you suspect your child or adolescent in suicidal, tell them that you are worried and want to help them. Remember, sometimes children or adolescents who are thinking about suicide won't tell you because they are worried how you will react. Your direct, non-judgmental questions can encourage them to not to share their thoughts and feelings with you, regardless of their response. If you suspect that the person may be suicidal, get them help immediately. Effective treatment and care of suicidal persons depends heavily on the individual's level of risk, person needs, and preferences. Approximately 90% of the people who die by suicide have a mental disorder at the time of their death. Because of this, Professionals widely agree that treating underlying mental disorders and assessing suicide risk are both vital elements in preventing suicides. That